Welcome to the class. One of the great purposes of this class is to help you write better, especially as a future healthcare or human service professional, a counselor, social worker, nurse, or other professional. Here's a term that I see many students use: issues. The purpose of this video is to help you find better terminology, more proper medical terminology. This particular term, issues, is appropriate when it is used to refer to topics that need to be discussed and resolved, such as the kind of issues that politicians would discuss, or ethical issues. What I have noticed over the last few years is that the term has taken on quite a different meaning. If you look at the popular Wiktionary, it says that the term now refers to psychological or emotional difficulties. Informal, figurative, and usually euphemistic terms. In other words, any problem or concern that is considered vague and intractable. Well, I don't know if this is the way you should be writing. The Urban Dictionary says almost humorously that issues is now a fancy and elegant way to refer to problems. I have heard the term technical issues used by computer people to refer to their challenges or problems. I've even heard traffic reports here in Southern California say that there are issues on the 405 freeway, indicating that there are traffic jams. But if you look at official medical dictionaries such as Stedman's, they're still using the term in the traditional way. Issue refers to some kind of fluid coming out of the body. I'm trying to find any other way of justifying the current use of issues. For example, in the Unified Medical Language System, I don't see it there. Look at the Harvard Health Publishing. It's not there. Look at the Oxford Dictionary of Psychology. It's not there. Look at the APA Dictionary of Psychology, and we see the traditional understanding of issue as something that has to be discussed and resolved, not a euphemism for all sorts of vague problems. One of the best helps to writing is the Purdue University Online Writing Lab, the Purdue OWL. And here they have a very important reminder. Litigation and auditing are a fact of life in the medical field, and chances are good that readers of your writing will be actively looking for mistakes or inconsistencies. When you use vague terms in your writing, you are subjecting your patients to all kinds of medical errors. You're subjecting your institution to a very precarious position in terms of future litigation and auditing by credentialing agencies. What you have to do is focus on very specific problems, difficulties, and challenges. Do this by using very precise medical terminology. Don't say issues.